Part of a successful surgical experience, and especially joint replacement, is to make sure you have done everything you can to assure you are prepared physically. This can best be accomplished by eating healthy. If you're diabetic, check glucose levels and follow your recommended diet. And as we will discuss as we go through the program, it will be important for you to understand what you can do to limit your risk for infection or blood clots. These are the two things we are most concerned about: prevention of infections and blood clots. See your primary care doctor or dentist if you have any signs of an infection. This includes the time from today until after you have surgery and through your life after surgery. You will want to make sure that any time you have evidence of an infection, be it a bladder infection or an ear infection or a tooth infection, that you seek out medical treatment for it. After surgery, it is important that you always tell healthcare providers that you've had your joint replaced. That doctor can help advise you if you need any antibiotics prior to the procedure. This can include things as simple as a tooth cleaning to any surgery or invasive procedure, such as a colonoscopy. If you smoke, you should stop. And while it is commonly known that smoking affects your health in a negative way, it is particularly important with joint replacement patients because smoking limits your body's ability to heal and puts you at risk for implant rejection. If you need support or resources to quit smoking, there are several listed in the back pages of the education book for you to refer to. Everyone who has joint replacement will need to be seen and evaluated in our ambulatory testing center. This is the opportunity for the anesthesia department to review your records. Everyone will be given a bottle of antibacterial soap. This soap is effective in killing bacteria such as staph, MRSA, or VRE. You must take 2 showers for it to be effective. Directions for the use of the soap are in your education book and will also be attached to the bottle. Please refer to the booklet that you received when you visited the ambulatory testing center for directions about when you should stop eating food or drinking liquids. Look for a list of medications you should stop taking the days prior to surgery. Most often, these are medications that may cause bleeding and would interfere with your ability to have surgery. Additionally, there may be medications you would want to take up to and including the morning of surgery, and they will be listed in this booklet as well.
We'd like to introduce these exercises to you today so that you become familiar with them before coming into the hospital. There are 10 exercises. Our goal is for you to work your way up, performing these exercises 2 to 3 times a day, 10 repetitions. We have found patients that practice these exercises prior to coming into the hospital have better outcomes. These are the exercises that you'll be using once you're discharged from the hospital at home. When you perform an ankle pump, you must feel the stretch on the front of the leg and the back of the leg as you perform the exercise. So as you're pulling your toe forward, you'll feel the stretch on the back of your leg, and when you point your toe down, you feel the stretch on the front of your leg. Flipping your toe up and down doesn't do anything. You want an exaggerated pump up and down. These exercises are your way of helping to prevent blood clots. The next exercise is called the glute set. The gluteal muscles are the large, broad group of muscles in the back of the buttocks. They're important for stabilizing the pelvis. The glute set is performed by squeezing the buttock muscles together and holding it for a few seconds and then relaxing. Remember to breathe when you perform these exercises. It's not good for your heart to hold your breath. The next exercise is called the quad set. The quadricep muscle is the large, broad group of muscle in the front of the thigh, and its function is to straighten the knee out. You can perform this exercise lying or semi-reclined. You simply straighten your knees into the surface you're sitting on, holding the contraction for a few seconds, and then relaxing. The next exercise is called a heel slide. You're simply sliding the heel up along the surface you're lying on a few inches up, and then lowering it back down, controlling it in both directions. After surgery, we will assist you in this exercise. The next exercise is called a straight leg raise. I often suggest you bend the opposite leg up, taking some of the pressure off the back. You're simply going to lift the leg up off the surface you're lying on a few inches and then lower it back down. The next exercise is called hip abduction. The word abduction means away. You're simply lifting the leg a few inches off the surface you're lying on. You're bringing it out to the side a few inches and then back in again and lowering it down. The next set of exercises you're going to be performing in standing. We suggest you use a sturdy chair like this, or you can use your kitchen countertop to support yourself. These exercises are going to be performed on the side you're actually having the surgery on. So if I'm having my right hip or knee replaced, I'm actually performing the exercise on that side. We don't suggest you perform these exercises on the non-operative side because you'll be bearing all your weight through the side you're already having pain in. The first exercise is called heel rises. So standing supported at the chair or at your kitchen countertop, your feet are shoulder distance apart. You're going to lift your heels off the floor and then lower them back down. The next exercise is knee flexion and standing. So standing supported by the chair or your kitchen countertop, your feet are shoulder distance apart. You simply bend the knee of the operative leg and lower it back down. The next exercise is hip abduction and standing. Similar to the exercise we performed on the mat, you're going to stand at a supported surface like the chair or the kitchen countertop. Your feet are shoulder distance apart. You simply bring your leg out to the side and lower it back in again. Remember when performing this exercise to maintain an upright posture. After surgery, you'll be using a rolling walker for a period of time to allow your hip or knee time to heal. This next exercise, the chair lift, prepares your upper body and your arms for using the rolling walker. Sitting in a sturdy chair like this that does not have wheels, you put your hands on the arm of the chair and lift your body weight up and lower it back down.